Good day, everyone. Welcome to our rationalization for long test 3 for Nloa 2, and I'm actually in charge of discussing the first 25 items of this examination. Let's begin with care of clients with physiologic and psychosocial alterations, part C, which is actually focused on legal and ethical issues in psychiatric nursing. Let's have question number 1. A patient in alcohol rehabilitation reveals to the nurse, I feel terrible guilt for sexually abusing my 6-year-old before I was admitted. Select the nurse's most important action. A. Anonymously report the abuse by phone to the local child protection agency. Letter B. Reply, I'm glad you feel comfortable talking to me about it. Or letter C. File a written report with the agency's ethics committee. Or letter D. Respect nurse patient relationship confidentiality. Of course, we know that this is actually a legal issue. So, the most significant uh, intervention that the nurse should do is to make sure that you have to protect the anonymity and confidentiality of the information. Therefore, we should be uh, mindful that we're going to uphold the patient's rights to of anonymity before confidentiality. So the best answer for number one is letter A, because of course it's very important that when we are going to be reporting possible child abuse, it should have to be treated anonymously, and you have to report it immediately because that's actually a form of violation of the patient's the violation of the child's right. So we are going to be protecting the patients and the child's protection, especially when we uphold this information to the public. So we know also that there are certain laws that usually prohibits disclosure without presence of a court order, except on any instances which the report can be made anonymously or without identifying the abuser as a patient in an alcohol or a treatment facility. So therefore, number one is letter A, and that's rational A. Number two, a family member of a patient with delusions of persecution asked the nurse, are there any circumstances under which the treatment team is justified in violating a patient's right to confidentiality? The nurse should reply that confidentiality may be breached. Letter A, under no circumstances. Letter B, at the discretion of the psychiatrist. Letter C, when questions are asked by law enforcement. Or letter D, if the patient threatens the life of another person. I think I was able to mention this one before, that there are actually instances that confidentiality may be breached, and that includes if that is in relation to safety of self and safety to others. The second one is if that is related to communicable disease, and the third one is when the patient died already. So in this case, the best answer is letter D, because that's actually the priority focus when confidentiality may be breached if there is actually problem of safety to self and to others. So letter A is eliminated, and it should not be the direct discretion of the psychiatrist or even the law enforcement, but the first priority then is all about safety of self and safety of others. Number two, the answer is letter D. That's the rationale. Number three, a new antidepressant is prescribed for an elderly patient diagnosed with major depressive disorder, but the dose is more than the usual geriatric dose. The nurse should A. Consult a reliable drug reference. B. Teach the patient about possible side effects and adverse effects. Letter C. Withhold the medication and confer with the healthcare provider. Or letter D. Encourage the patient to increase oral fluids to reduce drug concentration. Of course, we know that if that is specific for geriatrics, there is this computation that is based on the recommended daily allowances of this population. So, if the dose of antidepressants for elderly is actually being given, it should usually be less than the usual adult dose. And the main focus then for the nurse here is to withhold the medication and, of course, validate to the healthcare provider who actually wrote the order. And it is basically our responsibility as nurses to practice sound decision making and critical thinking, which is basically based on our professional standards in order for us to protect the patient as well as our profession. There's no need for us to consult a reliable dog reference because it's not, the reference is actually standard. So there's no need for us to refer there. And then teaching the patient about side effects is not our priority because we will be expecting that there will be more side effects and adverse reactions because the dose is more than the usual. And then letter D, encouraging fluid intake is not going to reduce then the side effects and adverse reactions. Number three answer is letter C, and that's the rationale. Number four, a patient diagnosed with schizophrenia believes a local minister steered evil spirits. The patient threatens to bomb a local church. The psychiatrist notifies the minister. Select the answer with the correct rationale. The psychiatrist A. Released information without proper authorization. Letter B. Demonstrated a duty to warn and protect. Letter C. Violated the patient's confidentiality. Or letter D. Avoided charges of malpractice. Of course, we'll eliminate letter D immediately because there's no such thing as malpractice. The psychiatrist here did not actually go beyond his or her professional responsibility. And then there's no violation of the patient's confidentiality because this is already a threat of safety to self and safety to others. So therefore, letter C is eliminated. And then the best answer for this four is letter B, demonstrated a duty to warn and protect because, of course, it is the healthcare professional's duty to warn or notify an intended victim after a threat of harm has been made. And then informing a potential victim of a threat is basically a form of legal responsibility of healthcare professional, and it is not considered to be a violation of confidentiality. So number four is letter B. So the answer is letter B for number four. Number five. A patient experiencing psychosis became aggressive, struck another patient, and requires seclusion. Select the best documentation. Letter A. Patient struck another patient who attempted to leave the day room to go to bathroom. Seclusion necessary at 2:15, and plan is maintain seclusion for 8 hours and keep these two patients away from each other for 24 hours. Letter B. Seclusion ordered by a physician at 14:15 after command isolation told the patient to hit another patient. Careful monitoring of patient maintained during period of seclusion. Letter C. Seclusion ordered by MD for aggressive behavior began at 14:15, maintained for 2 hours without incident. Outcome: patient calmer and apologized for outburst. Letter D. Patient pacing, shouting haloperidol 5 milligram given PO at 13, no effect by 13:15. At 14:15, patient yelled, "I'll punch anyone who gets near me," and struck another patient with fist. Physical, physically placed in seclusion at 14:20. Seclusion order obtained from MD at 14:30. So here, the question is all about best documentation. So of course, we have to make sure that it has to be timely prepared, no? And then of course the documentation must be specific, and there has to be specific details that is going to be included, which are basically considered to be part of the key aspects of care. And of course, it should also possibly demonstrate that there is an implementation of the least restrictive alternative, and then the justification for why a patient was secluded should be recorded along with interventions because seclusion is considered to be a form of detention already. And then interventions attempted in an effort to avoid seclusion. The documentation should include a description of behavior and also verbalizations of the patient himself, the interventions that you have actually tried, and also their specific outcomes. And at the same time, there has to be an inclusion of the name of the healthcare provider ordering the use of seclusion. Therefore, number five, the best answer is Delta. That's letter D. Number six. A person in the community asks, why aren't people with mental illness kept in state institutions anymore? Select the nurse's best response. A. Less restrictive settings are available now to care for individuals with mental illness. B. There are fewer persons with mental illness, so less hospital beds are needed. C. Most people with mental illness are still in psychiatric institution. Or D. Psychiatric institution violated patients' rights. Of course, eliminate immediately letter D, because it is actually not uh, part of the responsibilities of psychiatric institutions to violate patients' rights, because we are still going to uphold their rights even if they're mentally incapacitated. And then letter C is eliminated also because that is absolute. Most people, the word most makes it absolute, that they are actually still in the psychiatric institution, because most of them are basically being given the opportunity to live outside of the facility. So the best answer for number six is letter A, because the community is considered to be a less restrictive alternative than the hospitals for treatment of persons with mental illness. So letter B is also wrong, because it does not actually being proven that there is this less individuals who have actually mental illness, because there is an increasing incidence of drug abuse nowadays, and that might actually result into mental illness. Number six, the answer is letter A. Number seven, a patient experiencing psychosis asks a psychiatric technician, "What's the matter with me?" The technician replies, "Nothing's wrong with you. You just need to use some self-control." The nurse who overheard the exchange should take action based on A. The technician's unauthorized disclosure of confidential and clinical information. B. Violation of the patient's rights to be treated with dignity and respect. Letter C, the nurse's obligation to report caregiver negligence. Or letter D, the patient's right to social interaction. Of course, eliminate diretso yung letter C, because there's no such thing as negligence here. There was this no task that were not actually being implemented, and there was also no commission of respective duty. So there is also going to be no confidential informations that were actually disclosed. So therefore, letter A is eliminated as well. And then, of course, letter D, there was no violation of the rights of social interactions here. So the best answer for number seven is B, because, of course, the patient has the right to be treated with dignity and respect. And then the technician's comments regarding the patient's condition disregards the seriousness of the patient's illness. And of course, that is a form of code of ethics that requires intervention. So there is a need for us to promote emotional aspect, and then there's no such thing as negligence, as what I mentioned. And the interaction with the technician is not an aspect of social interaction, and there was no disclosure of very significant information from the patient. So therefore, the answer for number seven is bravo. Number eight, which documentation of a patient's behavior best demonstrates a nurse's observation? A. Isolates self from others, frequently fell asleep during group, vital signs stable. B. Calmer, more cooperative, participated actively in group, no evidence of psychotic thinking. C. Appeared to hallucinate, frequently increased volume on television, causing conflict with others. Or D. Wore 4 layers of clothing, states, "I need protection from evil bacteria trying to pierce my skin." So here, that is basically on observation. So the best answer here is letter D, because it states specific observation of the patient's appearance and the exact statements made. So there has to be a need for us to include what has been verbalized, and the other options are vague or subjective statements that and can be interpreted in different ways. So which is more valid here is when there is this what you call specific uh, specific verbalizations coming from the patient himself. Number eight, the best answer is letter D. Number nine, after leaving work, a nurse realizes documentation of A nurse realizes documentation of administration of a PRN medication was omitted. This off-duty nurse phones the nurse on duty and says, "Please document administration of the medication for me. My password is Alpha 1." The nurse receiving the call should A. Fulfill the request promptly. B. Document the caller's password. C. Refer the matter to the charge nurse to resolve, or report the request of the patient's healthcare provider. Of course, it might actually be a letter A is fulfill the request, letter B is document the caller's password, a letter C refer the matter to the charge nurse to resolve, or letter D report the request to the patient's healthcare provider. So in this case, documentation may be grounds for discipline by, of course, the Board of Nursing. Then referring this one to the charge nurse will actually allow observance of course, the presence of institutional policy while ensuring that documentation occurs. And then notifying the healthcare provider would be considered unnecessary when the charge nurse can already resolve them problem. And of course, as nurses, we should not provide passwords to others because that is part of our own identity because it might be used against us. Number nine, the answer is letter C. Number 10, which individual diagnosed with a mental illness may need involuntary hospitalization? An individual, letter A, who has a panic attack after her child gets lost in a shopping mall. Letter B, with visions of demons emerging from cemetery plots throughout the community. Or letter C, who takes 38 acetaminophen tablets after the person's stock portfolio becomes worthless. Or letter D, diagnosed with major depression who stops taking prescribed antidepressant medication. So we know that there is presence of involuntary hospitalizations when patients who are dangerous to themselves or others cannot care for their own basic needs. So we know that involuntary hospitalization also protects other individuals in the society. And when there is this occurrence of overdose of acetaminophen, that indicates that there is dangerousness to self and to others. And the behaviors described in the other options are not sufficient to require involuntary hospitalization. So the best answer here is letter C. That's letter C. Number 11. An aide in a psychiatric hospital says to the nurse, "We don't have time every day to help each patient complete a menu selection. Let's tell the dietary to prepare popular choices and send them to our unit." Select the nurse's best response. A. Thanks for the suggestion, but that idea may not work because so many patients take MAUI or the monoamine oxidase inhibitor antidepressant. Letter B. Thanks for the idea, but it's important to treat patients as individuals. Giving choices is one way we can respect patients' individuality. Letter C. Thank you for the suggestion, but the Patient's Bill of Rights requires us to allow patients to select their own diet. Letter D. Thank you. That is a very good idea. It will make meal preparation easier for the dietary department. Of course, the nurse's response is actually done to aid. To the aid should recognize patients' rights to be treated with dignity and respect, as well as their autonomy in order for them to make their own decision. So this response also shows respect for the aid and fulfills the nurse's obligation to protect supervision of this nursing aid. And it's actually important also for them to be given that opportunity. So best answer for number 11 is letter B. Array is wrong because you're actually assuming that you are focused only on Maui. There are actually other patients that are taking medication that has food and drug interaction. So number 11 is letter B. That's letter B. 12. In order to release information to another healthcare facility or third party regarding a patient diagnosed with mental illness, the nurse must obtain A. A signed consent by the patient for release of information stating specific information to be released. Letter B. Letter B. A verbal consent for information released from the patient and the patient's guardian or next of kin. Letter C. Permission from members of the healthcare team who participate in treatment planning, or approval from the attending psychiatrist to authorize the release of information. Of course, letter C and D have the same thought, therefore eliminate that. So the best answer for number 12 is letter A. So nurses have the obligation to protect the patient's right, privacy and confidentiality. Clinical information should not be released without the patient's signed consent for the release. So as much as possible, there has to be permission from the patient himself first before others. So that is number 12 is letter A. Let's proceed now to the next part of my topic, which is basically care vital clients in grief and loss. Question number 13. A nurse talks with a woman who recently learned that her husband died while jogging. Select the appropriate statement for the nurse. A. At least your husband did not suffer. Or B. It's better to go quickly as your husband did. Or C. Your husband's loss must be very painful for you. Or letter D. You will begin to feel better after you get over the shock. Of course, we know that the most helpful responses by this specific situation is to validate the bereaved person's experience of loss. So, as much as possible, you have to provide the patient with a broad opening. So, the best answer for number 13 is letter C. Letter D is actually false reassurance, and letter A and B has the same thought, did not suffer, and quickly has the same meaning. So, eliminate that. So, answer here is letter C, and that's letter C. 14. Family members ask the nurse, what can we say when our loved one says death is coming soon? To promote communication, which response could the nurse suggest for the family members? Letter A. We feel sad when you think about we feel sad when we think about life without you. Letter B. We have not given up on getting you well. Letter C. We think you'll be around for a long time yet. Letter D. Let's talk about the good memories we have. Of course, we'll eliminate letter C. That's actually false reassurance. And then letter B also is false reassurance. The best answer for number 14 is letter A. We feel sad when we think about life without you because that promotes an emotionally honest response to the patient, and it allows the family members the opportunities to express emotions, and at the same time addresses issues in the relationship and probably given time to say farewell. So answer for number 14 is letter A. 15. Which finding indicates successful completion of an individual's grief and mourning? A. For 2 years after her husband's death, a widow has kept her husband's belongings in their usual places. B. After 15 months, a widower realistically remembers both the pleasures and disappointments of his relationship with his wife. Letter C. 3 years after her husband's death, the widow talks about her husband as if he is alive and weeps when another mentions his name. Or letter D. 18 months after a spouse's death, an adult says, I have never cried or had feelings of loss, even though we were very close. Of course, when we talk about mourning, our goal is actually evolving from doing the grief work, getting over it, and of course moving on with life. And the work of grieving is over when the bereaved person can remember the individual realistically, and then acknowledge both the positive or the pleasure situations, and alongside with the disappointment associated with the loved one. So the individual then is free to enter into new relationships and activities. So with that, the best answer here is letter B. Letter A, there's actually fixation because the belongings has still been in place, and there is this what you call hoarding. And then letter C, there is no, that's already 3 years, but there's no uh, positive coping yet that is developed. And then also same as with letter D. So number 15 is letter B is the best answer. Next, number 16. A child drowned while swimming in a local lake 2 years ago. Which behavior best indicates a child's parents are mourning in an effective way? The parents A. Forbid their other children from going sleep swimming. Letter B. Keep a place set for the child at the family dinner table. Letter C, seal their child's room exactly as a child left it 2 years ago, or throw flowers on the lake at each anniversary date of the accident. So it's actually expected, no, that loss of a child is considered the highest situations for maladaptive grieving. So depending on many factors, this process can take many months to a number of years. And the parents who throw flowers on the lake on each anniversary date of the accident are often expressing their feelings. And the other options are actually considered to be wrong because there's no such thing as an effective mourning. A, B, and C are considered an ineffective mourning. The answer here is delta. That's letter D. 17. A patient with pancreatic cancer says, I know I'm dying, but I'm still alive. I want to be in control as long as I can. Which reply by the nurse shows active listening. A. Our staff will do their best to manage your pain. B. Your mind and spirit are healthy, although your body is frail. Letter C. It's important for you to let others help you to ease their own pain. Or D, are you saying you want people to stop focusing on your diagnosis? Eliminate immediately letter D because that's actually a close-ended question. And then also we'll have to eliminate letter C because that's considered to be a false reassurance. The best answer for number 17 is letter B. The patient has considered to be strength and capabilities, and even though the diagnosis is likely terminal, and that actually provides that there is an acknowledgement of the patient's capacity. So 17 is letter B. That's letter B. 18. A patient, a terminally ill patient says, I know it will never get well, but the patient's voice trails off. Select the most therapeutic response by the nurse. A. What do you hope for? B. Do you have questions about what is happening? Letter C. You are not going to get well. It's healthy that you accept that. Letter D, when you have questions, it's best to talk to the healthcare provider. Letter D is eliminated because that's actually withdrawal of the conversation. And then letter C is also considered to be something that is not therapeutic because it says you are not going to get well. That's already a prediction. The best answer for number 18 is letter A because it's actually an open-ended question and it requires an open-ended answer as well. So it provides an opportunity for the patient to speak about whatever is on his mind. So the answer for number 18, letter A. That's letter A. 19. A hospice patient tells a nurse, life has been good. I am proud of being self-educated. I overcame adversity and always give my best. I intend to die as I lived. The nurse planning care for this patient would recognize the importance of A. Providing aggressive pain and symptom management. B. Helping the patient reassess and explore existing conflicts. C. Assisting the patient to focus on the meaning in life and death. Or D. Supporting the patient's use of own resources to meet challenges. Of course, the patient whose intrinsic strength and endurance have been a hallmark often wishes to approach dying by staying optimistic and in control. Then helping such patients use their own resources to meet challenges would be considered the most therapeutic in this aspect. 19, the answer is letter D. 20. A widow repeatedly tells details of finding her elderly husband not breathing, performing cardiopulmonary resuscitation, and seeing him pronounced dead. Family members are concerned and ask, what can we do? The nurse should counsel the family that A. They should express their feelings to the widow and ask her not to retell the story. B. The retelling should be limited to once daily to avoid unnecessary stimulation. C. Repeating the story and her feelings is a helpful and necessary part of grieving. Or D. Retelling of memories is expected as part of the aging process. So letter D eliminate because that's already a form of stereotyping. And letter A eliminate that because that's considered to be not therapeutic because it's stated negatively. The best answer here is letter A and B are the same thought. The answer here is letter C. Because as nurses, we need to encourage to tell bereaved patients that telling the personal story of loss as many times as needed is acceptable and healthy because repetition is considered to be helpful and part of grieving process. 20, the answer is letter C. 21. A staff nurse asks a hospice nurse who should be referred for hospice care. Select the best response. A. Hospice is for terminally ill patients diagnosed with cancer. B. Patients in the stage of any disease are eligible for hospice. Or C. Hospice is designed to care for patients experiencing end-stage renal disease or patients diagnosed with degenerative neurological diseases are eligible for hospice after paralysis occurs. Letter A, C, and D is considered to be part of letter B. So we're looking for A, an umbrella effect answer. The best answer for number 21 is letter B, because hospice care are services provided to terminally ill regardless of diagnosis. 21 is letter B. 22. Which event is most likely to precipitate grief across community? A. A local bank is robbed twice in a single month. B. An adolescent shoots the principal of a local high school. C. The elderly pastor of the town's largest church dies of heart failure. Or letter D. Concrete pilings crumble in a bridge important to movement of local traffic. Of course, the most correct response here is when there is involvement of the public. You know? So that is considered to be a form of a public tragedy. So letter A, that does not include the public itself, and then the death of the pastor is actually in the house on their house. No, so there's no such thing as public tragedy. So the best answer for number 22 is letter B. Number 23. Which actions by a nurse are most appropriate when caring for a hospice patient? A. Giving choices. B. Fostering personal control. Letter C. Explaining curative options. Letter number 4. Supporting the patient's spirituality. Number 5. Offering interventions that convey respect. Number 6. Providing answers to the patient's questions about spirituality. So of course we know that uh, it's actually correct for us to allow patients to have choices. So we know that letter number 1 is actually correct. Number 2 is also correct because when you are giving choices, it means that there is personal control. Then curative options, that will not be included. So one number 3 is eliminated. Then supporting the patient's spirituality, that's also correct. And then number 5 is also correct. But what is not included here is number 6, providing answers to patients' questions about spirituality, because that's not actually part of your responsibility. You might refer this one to the hospital chaplain. So the answer here is 1, 2, 4, and 5. That's 1, 2, 4, and 5. And that is letter C. That should be letter C. That's letter C. Yeah, that's letter C. Sorry. That's 1, 2, 4, and 5. Number 24. Which patient meets criteria for number 24? Which, okay. Here, sorry. This is the answer. That's letter C. 1, 2, 4, 5. That's for number 23. Okay. Number 24. Which patient meets criteria for hospice services? 92-year-old diagnosed with acute pneumonia, 54-year-old diagnosed with glioblastoma, 16-year-old type 1 diabetes, 75-year-old diagnosed with chronic obstructive pulmonary disease, or 36-year-old with multiple sclerosis complicated by major depressive disorder and pain associated with muscle spasm. Of course, letter A is immediately part because that's already late stage Alzheimer's. And then, of course, we know that uh, this patient might actually have life expectancy of 6 months. Number five, eliminate. There's no options for number six here. So the best answer for number 24 is letter number one and two only. That's letter B. Okay, number 24 is letter B. Last number 25. As that approaches, a patient diagnosed with AIDS says, I do not have any enough energy for many visitors anymore. I'm embarrassed about how I look. I only want to see my parents and sister. Which action should the nurse take? Encourage the patient to reconsider this decision. Number one is wrong. That's actually uh, you are forcing the patient himself. Number two, support the patients to share the request of the patient's sister. That's correct. Number two, correct. Assist family to inform the patient's friends of the request. That's also correct. Suggest that the patient discuss his wishes with clergy. That's wrong because that's actually withdrawal. Then place a no visitor sign on the patient's room. There's a need for us to have the visitor, but only the parents and the sister. Answer for number 25 is number 2 and 3 only. That's 2 and 3. So that is letter D. So number 25, the best answer is letter D. So that is letter D. And that's it. Thank you very much for your time. See you again next time.